Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with JC Adams, who is the founder and CEO of Cloud9 Telehealth. And I really love what they're doing. It's innovative and it's just so collaborative, which is yet another theme that we hear so often in our interviews. They are an online portal that allows a person who might be suffering with mental illness or substance abuse or something along those lines to be connected with a provider and also with first responders. It gives everybody information they're able to share. And the goal is to avoid people who may not need to be going to jail or to the hospital to go to the appropriate places. So they get connected with the resources that they need and everybody's benefiting, and it provides tremendous cost savings. And so it's invite only. You have to be invited through your provider. And I thought it was really cool that it better informs particularly the first responders, because police, EMS, they don't know what they're going to a lot of the time. You know, maybe they have a general idea, but they really don't know what they're walking into, and they just have to be ready for anything. And by using Cloud9, they're able to go in and see that this person prefers to be called by a certain name. This person struggles with this particular substance or has this mental illness, and allows them to go in and actually they can use the telehealth platform to add in a provider who could help talk them through the situation at that time and avoid people from going to jail or to the hospital. It was a really revolutionary model. I love that. And then as a side note, they're also working on another recently launched platform that allows peer-to-peer support, which is helping them solve the issue of shortages within the mental health care world. So it's, you know, JC was telling us that going back to AA and other organizations like that, peer-to-peer support is shown to be very effective. And by using Shine and allowing these people to actually get paid, they are able to help with that crisis, which really is a big deal right now. There are not enough providers. So that's what stood out to me. Apoorv, what did you walk away with?
Yeah, it's Stephanie. I think JC is such a inspiring individual. As you were saying, he comes from a rural community, and he lost a number of his friends and family to mental illness because they just didn't have access. There weren't enough providers. They couldn't access them. They didn't have the technology. And so this is a very deep-rooted need and concern for him. And it's very personal. I think that you feel that right away as soon as you meet him and understand the company that he's building, because he's not shying away from any of the challenges. He's not creating a company just for the bells and the whistles and for the shiny technology, and he's not trying to go for the glitz of it. Certainly, he's got a company that does have all those bells and whistles, but he's trying to help the most disadvantaged populations, the ones that are hardest to reach, the ones that are vulnerable, and he's trying to figure out ways in which you can use data and technology to connect the community in such a way that they're all better able to communicate with each other. And therefore, the cop now, instead of having to pay for an expensive support person to ride along with them, can now have access through telehealth to a bona fide clinician who can then be someone who can help on an encounter. And I think that winds up then keeping patients out of crisis. It winds up keeping them out of the emergency rooms. It winds up keeping them out of jails, which is not where these patients belong. Unfortunately, as clinicians and consultants, we see the broken healthcare system and how often these patients are winding up in these settings. So I can easily see the impact that a solution like his could have. And as you had mentioned, it's extremely innovative because I've not really heard of too many other people that are trying to develop a solution like this. So to me, it's hats off to JC for trying to be true to the memory of his friends and family, and creating a solution that could really help the next set of people that are going to be in crisis.
Absolutely. It really was. It's a mission-driven company. JC is amazing. I can't believe that he's figured out such an elegant way to put it all together and help these people, both the patients and the providers and the first responders. And so definitely it's another don't miss interview. So be sure to check it out, and we'll talk to you all soon. Bye-bye.